Doctors of Reddit, what is the symptoms or illness that people often ignored because they think it is not big deal but in fact, they need to see doctor immediately? Frequent urination. The amount of liquid you get rid of is actually a pretty big deal. I can attest to this. I had this issue for a good 3 months. It got to the point where I wouldn't know I had to pee until it was almost too late. Finally a family member of mine forced me to see a doctor because we thought it was a UTI. Nope. Bam. Diabetes. I am a doctor, late to the party, so this will be buried, but here's a non-exhaustive list of common things that people ignore and really shouldn't. Black poo, white poo, red in your poo, pink or red wee, unless you've been eating a fuck ton of beetroot. Unexplained weight loss, unexplained weight gain, decrease in appetite, confusion, unless you've been drinking a lot of alcohol or taking drugs. Early morning headaches, same caveat as the last one. Rapid alteration in vision, dark spots in your vision, smelling weird smells when there's nothing there, hearing voices that aren't there, rapid hair thinning, babies not peeing much, unexplained bruises on your children, weird behavior in your children. I'll add more as they come to me. These are things to see your family doctor about, not rush to the emergency room with. Besides, if you run into emergency rooms yelling "Oh my god, I have red coming from my butt," you'll just look like a crazy person. Unless it's a lot of blood, like cupfuls at a time, in which case do that. Smelling weird smells when there's nothing there. Burnt toast. A newborn that hasn't peed in 1 day is in trouble and needs to be seen immediately. My dad ignored the massive headache that was making him physically ill and kept him from sleeping. The next day, my mom forced him to go to the ER. Turns out he had a ruptured intracranial aneurysm. Sudden massive headache? Go to the doc. Since people are asking, he was fine, but he probably should have died. The aneurysm was over an inch long when it ruptured, and he delayed treatment for around 24 hours, but somehow he survived with no brain damage. His doctors like to tell him you should be dead. It's also good to know that aneurysms can be genetic, so if your siblings or parents, or children, have one, you should get yourself screened with a Mr. Angiogram. Basically an MRI with contrast in your bloodstream. When I was 15, I started getting massive headaches at the end of summer. I never got headaches, ever. I told my parents for 3 days that I was having headaches. So bad, mind you, that I sometimes had trouble walking straight or sitting up, and they just thought I was exaggerating. They finally caved and took me to a doctor. I had been running a fever of 103 for about a week straight. I once crap orange oil, literally oil. The toilet bowl looked like someone just dropped about a quarter bottle of vegetable oil in there. I WebMD'd that crap, literally, and I was freaking out. As it turns out, that's one of the signs of pancreatic cancer. Just about everything on WebMD is, or celiac disease. Anyway, went to the doctor, got that crap checked out, MRI, and it turns out that I had a one-time episode of steatohea malabsorption. In other words, my body couldn't digest the fat. Not much to explain why this happened, but my god, you haven't seen fear until you have an oily butt. I'm not a doctor, but last week my crap turned black. I didn't know why. Turned out I had an ulcer. Lost half my blood in 3 days and nearly died. If your crap turns black, get yourself to a hospital pronto. Chest pain, especially if it radiates to the left arm jaw. Big sign of a heart attack. Do not ignore. Blood in stool, urine, cough. Pretty much blood anywhere it shouldn't be. Sudden shortness of breath, like if you used to run 2 miles a day and then suddenly can't climb upstairs. You don't get out of shape that fast. It could be pneumonia. Cold fever, cough lasting for more than a few days. Only a second year med student here, but they always harp on thunderclap headaches or very sudden intense pain. Sometimes behind the eye. Could be an aneurysm. Deadly if not treated quickly, or something called temporal arteritis that can lead to irreversible blindness. TLDR. Bad headache can equals death blindness. I'm not a doctor, but any kind of head injury should be checked out. You hear stories about people thinking they're fine and then dying the next day. That's how Liam Neeson's wife died. That's how my brother died. Went skiing, fell down, hit his head against a tree, decided that was enough for the day, felt sleepy, went home, Woke up the next morning, went to church, started having convulsions in Sunday school, died in the ambulance. Unexplained weight loss. But I look fabulous. Dive medic here. Any neurological signs symptoms that appear after a scuba dive, please tell someone. On a lighter note, my dive master had a couple out on the boat with him who hugged and kissed a sunken statue for a photo. A statue covered in fire coral. Said they both looked like those bug-eyed goldfish with their puffy faces and lips. Doc here. My advice. 1. High blood pressure. I don't necessarily mean an acute elevation, which is bad, but not too common. But I see too many folks ignoring their borderline hypertension or not wanting to start medicine, exercise, diet, etc. By the time we've diagnosed you with high blood pressure, your arteries have probably already sustained some damage. And people worry rightfully about high BP causing heart attacks and strokes and aneurysms. But kidney disease tends to sneak up on people. Ask your doc to check your renal function. 2. Diabetics. Get your eyes checked. Retinopathy will sneak up on you before you notice it. 3. Quit smoking. As a doc, if I see you come in with any of the stuff folks have posted here, and I see you have a significant pack history, I get a bit more scared. Actually, everything I said in one also applies to high blood sugar. I shouldn't be giving out too much advice, so I'll stop here. Acceptable blood pressure ranges can change based on a person's medical history, age, etc. Calf pain, especially if the leg starts to swell or gets red, could be a deep vein thrombosis, blood clot, which can in turn dislodge and become a pulmonary embolus, blockage in your lung. This is a very bad thing. Risk factors: taking birth control pills, smoking, prolonged immobility of the limb, etc. And here I'm sitting cross-legged with a cat on my lap who won't let me move. Obviously not a doctor, but peeing blood and back pain : I don't know about other people, but peeing blood would freak me the heck out. Night sweats. I'm not talking about waking up a little damp. I'm talking about you need to change your clothes and sheets. Night sweats. If this is happening frequently, it could be the sign of certain blood cancers which can have a mild symptom presentation. If you're outside the US or endemic areas, tuberculosis can have similar symptoms. Malaria is another disease associated with this. The key thing to note is this happens without any known causes. There are times when you may have night sweats, heat, booze, meds, flu, etc. It's only worrisome when it happens multiple times for no known reason. Chest pain. Chest pain that is extremely bad and doesn't go away, accompanied by any of these other symptoms, can be an indicator of a heart attack. Chest pain, shooting pain in both arms and or lower back, discomfort in the jaw, neck, shoulders, arms and back, nausea, shortness of breath, sweating, lightheadedness, denial. Denial is a big one. No one wants to think that they are having a heart attack, because only really big, fat people have heart attack. If you or someone else thinks you are having a heart attack, call 911, chew an ASA, baby aspirin, or regular aspirin, and sit or lie down until the ambulance comes. Because the only thing that sucks more than having a heart attack is dying because you refuse to accept the possibility. Having chest pain that is accompanied by chest pain would suck balls. Coughing blood. I've had blood in my stool for years. I assume hemorrhoids, SPM at the right now because I've had deep red blood in the toilet going on 3 days now, and I got super dizzy. First thing I did is went upstairs and told my GF I loved her, then jumped in the shower, cause gross. I don't want a doctor to examine a dirty nasty body. Hopped out and asked GF to drive me to a 8:30ish. Blood tests being done. Will update whether it's threatening or not. 9:40, doc did rectal exam. Said no hems. 9:55, had x-rays taken. 10:50, tests and x-rays back, all normal. Doctor said it's probably diverticulitis ulcerative colitis, which he said is fairly common, not really threatening. If symptoms are still apparent after 1 week of antibiotics, we'll need a colonoscopy. So, in not dying, take that, colon cancer. Pro tip: if you have to get a colonoscopy and you have to drink the nasty liquid, pick a flavor of Gatorade, or what have you, that you don't plan on enjoying again. I can't drink lemon lime anymore personally. If you start seeing Daleks, you need to find a doctor immediately. Reflux heartburn. Continued exposure of the esophagus to stomach acid can lead to cancer and can be easily prevented, not to mention eliminate the symptoms, with medication, once properly investigated by your doc. My dad died of esophageal cancer and none of us even knew he'd suffered from heartburn his whole life. He said he just ignored it, didn't think it was a big deal. From diagnosis to death was 8 months. It's a crappy, fricked up cancer. Not a doctor, but if you're an older person who just got stung by a bunch of bees, and your tongue starts swelling, tingling, you get dizzy, short of breath, or any other allergic reaction symptoms, don't do what my dad did and take a cold shower then drive yourself to the hospital when someone else was perfectly able to take you. Turns out you can develop a deadly bee allergy later in life. Also, don't call your daughter, who has her phone on silent, who is only taking prerequisites for nursing school, if you experience similar symptoms while taking Rogaine for the first time. Mainly, Dad, just go to the goddamn hospital, for Christ's sake. Unexplained increase in abdominal girth. Most people think they're just getting fat, but it can be ascites, which is a sign of liver failure. Your skin white of your eyes will most likely have a yellowish hue to it by this point. My hands, mostly fingers, have been tingly and numb for the past few hours and I'm scared. Well, I woke up today and they were still a bit tingly. I took a multivitamin and it went away. I don't know if it was the vitamin that did it, or just time. This happens to me when I have anxiety attacks, but if it persists, go see your doctor. Don't Google the symptoms or you'll end up convinced you're dying from a disease that has only infected 6 people on a remote island you've never even been to. 1. Rectal bleeding. 2. Loss of height. 3. Sudden blindness. AWW crap, I can't see. A. Probably nothing. Bloody stool. Genital bleeding in a woman past menopause. It is not normal and is generally a sign of something serious, like cancer. If you are no longer menstruating and you bleed genitally, there is a tendency to think, no big deal. It is in fact a huge deal. See a doctor immediately. Truth. My mother was smart and booked an appointment the first time that happened to her. Precancerous cells were found in her uterus. A full hysterectomy later. She's cancer free and doing just fine. No further treatment necessary. Hypothyroidism, hypothyroidism, or any other thyroid issues are usually ignored not only by patients but also by doctors. Hypothyroidism has around 300 symptoms that seem so small that people don't think of them being a symptom or assume that's just the way their body is. Some of these can be weight issue, memory problems, anxiety, depression, muscle pain, to just name a few. Due to the thyroid being a very important gland as it affects a lot of functions in the body, it should be something that gets checked out. Though there seems to be a link between untreated hypothyroidism and thyroid cancer. Another symptom that should be checked is swollen lymph nodes, as it shows a sign that something is wrong, like an infection or cancer. I'm finding out that the lymph node on my neck that's been there since I was 10 years old was most likely a sign that I had cancer, because while being treated for cancer 18 years later, it's now shrinking for the first time, due to my doctor just claiming it was nothing and probably from a cat scratch. It's not, as I now know that the lymph nodes that would have swollen from that has to be from the same area the scratch was at. My cat never scratched me on my neck. I have been possibly living with cancer for 18 years. I would say appendicitis. People tend to misconstrue fever and pain for a while, but if it goes on for a while, go see a doctor, people. I'm no doctor, just a nurse's aide, but I see this a lot. Appendicitis is pretty darn hard to ignore in my experience. Most people are in tremendous amounts of pain. If you're feeling lightheaded at rest, you probably have an underlying heart arrhythmia. Not worth going to A&E for, but definitely see your GP. Not a doctor, but if you suddenly feel weak and dizzy for no apparent reason, consider carbon monoxide poisoning as a potential cause. It doesn't take much to kill you, and you absolutely need medical treatment for it. Smokers are at higher risk because they have some CO already in their bloodstream. Buy a CO detector. Treat it like a smoke detector with replacing the batteries and testing it. Also, it's not completely related, but protect your eyes and ears. Sounds over 80 dB are loud enough to cause permanent, cumulative damage. Listening to loud music through earbuds and headphones is especially bad. If it hurts your ears, it's causing damage. Your lifetime exposure to UV light will lead to crap you don't want in old age, like cataracts and macular degeneration. Flashes in your vision with floaters. Go to hospital immediately, as you probably have a detached retina. It happens a lot more than you think. My wife went immediately and her sight was saved. My friend's father waited and he is blind in one eye. Neck stiffness with a headache, or neck stiffness alone, can potentially be meningitis, which can kill you. Your skin isn't supposed to be yellow or orange. If the whites of your eyes or your skin look yellowish, it's probably liver failure. You should go to the hospital ASAP. Also, college students and low income learn the signs of scurvy. A friend of mine ate nothing but Kraft dinner in university. When his dad saw him, he was force-fed oranges. If your pee foams, you should probably see a doctor, since you might have a nephritis, kidney infection. If you have swelling in your feet in addition to the foaming, that's a pretty definite sign of the infection and you should go to an ER ASAP. This info provided by my mother, who's a nurse. Bleeding gums when you brush your teeth or floss. Your dentist is a doctor and needs to check that crap out. If you become really thirsty, I was drinking more than 5 glasses of water before lunch, go see a doctor. Extreme thirst is an early sign of diabetes, and if you get treatment and education early enough, you can slow or even reverse the condition. You have been visited by the holy doggo. Like and subscribe, you magnificent person.